Good morning, everyone. I hope you remember that last week we have discussed about the gross anatomy of uterus. Okay, we have discussed about the gross anatomy of uterus. Now, few portions are left. Let me complete that, and then I will start with the applied anatomy of uterus. Okay, so today mainly we will be focusing on the applied anatomy of uterus. Okay. Now, if you have observed that whenever we are discussing about any gland or any organ in our body, okay, especially the gross structure, in that whatever we have discussed earlier, along with that you also have to know about the blood supply, nerve supply. Okay, so blood supply and nerve supply is also important. Okay, now when the term blood supply is used, what is the meaning of this? The term blood supply means you have to describe about the arterial supply and venous drainage. Okay, so any organ, as I said, the blood supply, nerve supply is very important. Now in case of blood supply, two things are coming. What are they? Arterial supply and venous drainage. Okay, so in the last class we have seen what is the arterial supply for uterus. Can anyone tell me what is the arterial supply for uterus? It is, it's mentioned over here. It is uterine artery. Along with that, see, it's mentioned. Along with that, the ovarian arteries are also there. Okay, so why I am showing you this? So first, arterial supply will be there. Okay, and then the venous drainage is also there. Okay, so you have to know this thing, because during the time of exam, if it comes, you have to mention. Blood supply doesn't mean only the arterial supply. You have to mention about the venous drainage also. Okay. So these two arteries are supplying the uterus. Along with that, these two arteries, that is the uterine artery and the ovarian artery, okay, they will anastomose at the lateral border of the uterus. After that, the branches which are coming out, they will supply the various part of the uterus. Along with that, they are also supplying the cervix, and they are supplying some part of vagina also. Okay. Now for that, already I have shown you the diagram. As you can see in the diagram, so the internal iliac artery is there. So the internal iliac artery will give rise to the uterine artery, and the speciality of the uterine artery is it is tortuous in nature. Okay, speciality of the uterine artery, it is tortuous in nature. Last time I have told you that along with the uterine artery, there are some other arteries also in our body which are tortuous in nature. For example, splenic artery. You have studied about splenic circulation. Okay, so if you see the splenic artery, that is also tortuous in nature. Now the question is, why those arteries are tortuous in nature? Why it's not straight? Because of the movement of that particular organ. So we know that during the time of pregnancy, the size of the uterus increases enormously. Okay, at that time, if the artery is straight, it will not be able to supply the enlarged uterus during the time of pregnancy. Okay. So that's why the arteries are tortuous. So here you can see the ovarian artery and you can see the uterine artery. They will anastomose. The branches which are coming out supplies the uterus. Okay. Next, in the venous drainage, as you can see, the plexus drain through uterine, ovarian and vaginal veins, and ultimately they will drain into the internal iliac vein. Okay. So last time while discussing about the inferior vena cava, I have shown you the common iliac vein, then the internal external iliac vein, from where they are coming, how they are joining. Okay, everything we have discussed. Okay, so this why I have mentioned, to make you understand that whenever you are studying about any organ in blood supply, what you have to write? You have to write about the arterial drainage and arterial supply and venous drainage. Okay. Next is the nerve supply. So if any organ is there, then nerve supply will also be there, right? So here you can see the nerve supply. Now again, in the nerve supply, especially in case of abdominal organs, because now we are in abdomen, so I will focus. You have noticed that if you study any structure, in case of nerve supply, it is divided into two types, that is sympathetic nerve supply and parasympathetic nerve supply. Till now you have not studied the nervous system. Okay, so the detail about sympathetic, parasympathetic is not known to you. But in the upcoming classes, we'll be discussing about that also. Okay. But for the time being, please keep that in mind, that in case of nerve supply, It is divided into two parts, sympathetic and parasympathetic. That you have to mention whenever you are writing in the exam. Next, what you have to mention is, if it is sympathetic, what is the source? If it is parasympathetic, what is the source? That means the sympathetic fibers, it is coming and supplying the organ, right? So from where it is coming, that you have to mention. That is the source of the sympathetic nerve supply. Similarly for parasympathetic. Okay, second point. And third point is, what is the function? If sympathetic is there, what is the function? If parasympathetic is there, what is the function? Okay, so these three simple points you have to mention in the writing part, or whenever you are preparing notes, or whenever you are studying. That makes a sense about the nerve supply. Okay, as you can see, I have mentioned that the uterus is richly supplied by both sympathetic and parasympathetic nerves. Mainly it is derived from inferior hypogastric and ovarian plexuses. So the inferior hypogastric ovarian plexus, these are nothing but the plexus of nerves where both sympathetic and parasympathetic divisions are present. Okay, so from there the fibers are arising and then they will go to supply the uterus. Okay, now among them, if you see the sympathetic, what is the root value, or from where the fibers come? That is T12 to L1 segment of the spinal cord. Okay, that is where the sympathetic fibers are coming. Now we have seen sympathetic fibers are coming. Now what is the function? Now the function is uterine contraction and vasoconstriction. These are two important functions, okay, which is governed by the sympathetic nerve supply. Okay. Next, in case of parasympathetic, as you can see, S2 to S4. Now what is the function? Please keep that in mind. Sympathetic and parasympathetic functions will be opposite to each other. Okay. Always sympathetic and parasympathetic functions are opposite to each other. Now in case of parasympathetic, from where it is coming, S2 to S4, what is the function? Uterine inhibition and vasodilation. Okay. However, the phenomena is not that simple, because there are numerous hormones secreted, and those hormones are also playing an active role in the vasoconstriction, vasodilation, okay, then thickening of the endometrium. Okay, so all those things are also taking place. That we'll discuss in histology class. Okay. Next, the pain sensation from the body of the uterus is passing through sympathetic nerves and from cervix along with the parasympathetic nerve. Okay, so the pain sensation which is there, that has to be carried. Now how it will be carried? From the uterus it is carried by the sympathetic nerve, and from the cervix it is carried by the parasympathetic nerves. Okay, so that is how you are writing or studying about the nerve supply of any particular organ. Okay, so we have discussed the blood supply, nerve supply. What is left? That is the lymphatic drainage. Lymphatic drainage. Now can anyone tell me why lymphatic drainage is important? Do you remember the lymphatic drainage of breast? You have not studied lymphatic drainage of breast. Very important. Okay. So we know that the lymphatic drainage is important because through those lymph nodes the metastasis can take place. Okay. I hope you have heard about cervical cancer. Fourth most common type of cancer occurring in any female individual. Fourth most common type of cancer. This is the cervical cancer. Okay. Different stages are there. And when the metastasis is taking place, at that time, these lymph nodes, they are playing an active role in doing the metastasis. Okay, so that's why there are some organs, particular organs in which the lymph nodes are very important. So don't miss it. For example, in case of breast, okay, lymphatic drainage of breast, along with that the applied importance. After that, uterus, lymphatic drainage of uterus. Okay, so as you can see, the lymphatic drainage. Now what happens in case of lymphatic drainage? So there are three intercommunicating networks which are present in the uterus. It includes the endometrial, myometrial and subperitoneal. Okay, these are the intercommunicating networks. So what they will do? They will collect the lymphatics from the uterus, and then it will be given into the other various parts of the lymph nodes which are situated around the uterus. Okay, Now, these lymphatics which are drained from the uterus from the either side is divided into three categories. That is the upper lymphatics, middle lymphatics, and lower lymphatics. Okay. So as you can see, the upper lymphatics from the fundus and upper part of the body, where they will drain into the aortic nodes. Okay. Previously, while discussing about the posterior abdominal wall, I have shown you the lymphatic drainage. Okay, and I have also shown you the thoracic duct, if you remember. And partly the superficial inguinal nodes which are present around the round ligament of the uterus. Middle lymphatics, as you can see, lower part of the body, and they will drain into the external iliac nodes. And the lower lymphatics, they will drain the cervix into the internal iliac and sacral nodes. Okay, like these various parts are draining into the various lymph nodes. Now for your reference, you can see the diagram. Now in this diagram, you can see these are the upper lymphatics, middle lymphatics, and lower lymphatics. Okay, so from the upper lymphatic, as you can see, it is going to the aortic nodes. From middle, mainly it is going to the external iliac nodes, and lower, you can see internal iliac and sacral. Okay, so this is how the lymphatic drainage is taking place. Okay, now as I said, today we will be discussing in detail about the applied anatomy. So in that we will see how the cervical cancer, the metastasis is taking place. Now there are some age related changes. Okay, age related changes taking place in the uterus. I hope you know that. Okay, when at that fetal life, then puberty, during menstruation, during pregnancy, and in old age. Okay, so different changes are taking place. So what happens in first case, in fetal life, the cervix is larger as compared to the body. Okay, though you have not studied the development of the uterus, okay, so you will not know, but please keep that in mind. In case of fetal life, the cervix is larger as compared to the body of the uterus, and it is projecting above the pelvic brim in case of fetal life. Next, during puberty, the uterus enlarges and descends into the adult position during the puberty, and along with that, the arbor vitae also appears. Can anyone tell me what is this arbor vitae? Arbor vitae uteri. Have you heard about it? Anyone? If you see the cervical canal, the cervix which is there, as I said in the last class, it is in cylindrical structure. If you see the cervix, it is in cylindrical structure, extending from the internal os to the external os. Okay, that is the extent of the cervix. Length is approximately 2.5 centimeter. Now the walls of the cervix, anterior wall and posterior wall of the cervix, okay, mostly they are closed unless and until something is passing through it. Okay, the walls are closed. Now, if you see the anterior wall and posterior wall, the mucosal pattern of the anterior wall and posterior wall is in such a way that they interlock with each other. Okay, anterior wall, posterior wall, they will interlock with each other. Okay, so such pattern which is present in the mucosal wall, okay, this is called as arbor vitae uteri, because it appears as branches of tree. Okay, that's why it is called as arbor vitae uteri. So that appears during the time of puberty. Next, during the menstruation, already you know what happens in the uterus during the time of menstruation. Okay, slightly enlarged and becomes vascular. The lips of the external os are swollen during the time of menstruation. Next, during the time of pregnancy, the size increases enormously. The hypertrophy of the muscles takes place. Along with that, hyperplasia also occurs in the uterus. Then the uterine wall becomes progressively thinner during the time of pregnancy. Okay, so these are different changes which are taking place during the time of pregnancy in the uterus. Next, in the old age, what will happen? Old age means after menopause. What will happen? The atrophic changes will take place in the uterus. Okay. The size decreases, it becomes more dense, the internal os is frequently obliterated, the lips of the external os disappear, and it may also be obliterated. So these are some changes which are taking place at old age, mostly after menopause. Okay, so these are some age-related changes occurring at various stages of life in the uterus. Okay, so that is all about the uterus. Now we'll start with the applied importance. Okay. Now, in the applied importance of the uterus, there are many applied importance. So, we'll try to figure most important applied importance of the uterus. Okay. So, first you can see in the applied importance of the uterus, first one is the ovula Nabothi, or also called as Nabothian cyst of the cervix. Nabothian cyst of the cervix. Anyone have you heard about this Nabothian cyst? For your reference, I have added this diagram also, the image also, where you can see the Nabothian cyst, and along with that the inflammation can also be seen in the wall of the cervix. Okay, so what exactly it happens? So see, in the mucous membrane of the cervix, when you will study the histology, at that time you will come to know that in the mucous membrane, numerous mucus secreting glands are there. Okay, and if you see the gland, they are tubular and branched. Simple tubular or branched tubular glands are present. Okay. Now what happens? Sometimes the opening of the glands are blocked. Okay. Now they retain the secretion and produces cystic dilatation. So the opening of the gland, if it is blocked, so continuously secretions are taking place. Okay. As a result, what will happen? Dilatation will be there, and this is in the form of cyst. Okay, also called as cystic dilatation. And they bulge into the cervical canal. So when the dilatation will be there, it will bulge into the cervical canal, and then at that time it will be visible. Okay, so that condition is called as ovula Nabothi, or also called as Nabothian cyst of the cervix. Okay. Next, intrauterine contraceptive devices. So already you have studied this in I think 10-12 standard, right? So why these contraceptive devices are used? Why these contraceptive devices are used? Yes, to prevent the pregnancy. Okay. So mainly it is of two types. As you can see, it is of two types: copper containing and hormone releasing IUD, intrauterine devices, which are placed inside the uterus. Okay, to prevent the pregnancy. And as you can see, one diagram I have shown. Next, bicornate uterus. Now, this is a developmental anomaly. Okay, this is a developmental anomaly. Now, what happens? The uterus is mainly developing from mesonephric duct, as you can see, paramesonephric duct. Okay, which forms the uterus. Now, if those paramesonephric duct, if they are not fusing during the time of development, at that time such kind of anomalies can occur. Okay, so incomplete fusion of the embryonic paramesonephric duct, okay, can result in the formation of various congenital anomalies ranging from the formation of unicornuate uterus, okay, duplication to form bicornuate uterus, double uterine cavities, or completely double uterus. These are the different congenital anomalies which occurs if there is not complete fusion of the paramesonephric duct. Okay. For your reference, I have shown the diagram. As you can see, what happens in case of bicornuate uterus and the normal uterus. Okay. Next is the uterine prolapse. Last time, I hope you remember, we have discussed about the perineal body. Okay, what is perineal body, where it is situated, that we have discussed. And then we have also discussed about the supports of the uterus. If you remember, the supports of the uterus, different types of supports are there. And I have told you that the supports of the uterus are very important. Why? Because during the time of pregnancy or after pregnancy, what happens? The support, if there is any damage to those support, there may be prolapse of the uterus. Okay. Now, what exactly is that prolapse of the uterus? The herniation of the uterus into the vaginal canal. Okay, the herniation of the uterus, when the uterus herniate into the vaginal canal, at that time it is called as the uterine prolapse, and that is due to the weakening of the supports which are provided to the uterus. Okay, so various supports are there of the uterus. If those supports get weakened, at that time there may be prolapse of the uterus. And how it takes place? It will herniate through the vaginal wall and then it will come out. That is the prolapse of the uterus. Now, what are the causes of the prolapse of the uterus? Now, if a person is having higher BMI, okay, at that time the chances of prolapse are common. Then when, as you can see, damage to the perineal body, at that time also it is common. Next, there are some important factors, and these are the congenital anomaly. For example, as you can see, Marfan syndrome, Ehlers-Danlos syndrome. These are also two important congenital anomalies in which the problem is there in the connective tissue, mainly in the elastic fibers and the collagen fibers. I hope you remember, we have discussed that in connective tissue, collagen fibers are there, elastic fibers are there. These are the components. Okay. So during this disease, congenital anomaly, what happens? The problem is there in the elasticity of the elastic fibers and in the collagen fibers. Okay. So at that time also the supports which are provided to the uterus, it becomes weak. Then, so these are different causes why the prolapse of the uterus can take place. Okay. Now there are different stages of the prolapse of the uterus. Okay, different stages are there. Now this stage was governed by pelvic organ prolapse quantification, and it was created in 2002. And according to them, there are different stages of uterus prolapse or uterine prolapse. And as you can see, these are the various stages. So stage 0 means no prolapse. Okay, prolapse has not yet started. Now in case of stage 1, the most distal portion of the prolapse segment is more than 1 centimeter above the level of the hymen. Next, in stage 2, the most distal portion of the prolapse is 1 centimeter or less proximal or less distal to the hymen. And in case of stage 3, most distal portion of the prolapse will protrude more than 1 centimeter below the hymen. Okay, but not further 2 centimeter less than of the vaginal length. That is the stage 3. And stage 4, complete eversion of the vagina. Complete eversion means turning inside out. So these are the various stages of the uterine prolapse. Now let me show you the diagram so that you can understand the prolapse of the uterus. So stage 0, as I said, no prolapse is there. Okay. Now here you can see in the stage 1 what happens. The upper part of the uterus, okay, in the upper half of the vagina, then the uterus has descended nearly into the opening of the vagina, and in case of stage 3 has protruded out of the vagina, and stage 4 where eversion is taking place, that is completely out of the vagina. Okay. As you can see, the various stages where the prolapse of the uterus is taking place. Okay. So we have seen what is the prolapse of the uterus. Along with that, we have also seen why the prolapse are taking place, and then what are the stages of the prolapse of uterus. Okay. Next is the cervical cancer. Very important point, cervical cancer. Now there are various reasons of the cervical cancer. Okay. Now among them, the most important cause is HPV, that is human papilloma virus. Okay, HPV, human papilloma virus. So when the person is affected from that virus, the wound which will be formed in that particular area, gradually during the time of healing, the chances of getting cervical cancer is very common. Okay. So as you can see, the fourth most common type of cancer is the cervical cancer. The most common one includes breast cancer is there, lung cancer is there. Okay. Now mostly, as I said, it is caused by HPV or human papilloma virus. Now high risk type HPV can lead to cervical intraepithelial lesion. Okay, intraepithelial lesion occurs whenever a person is suffering from HPV, and over the time it progresses into the cervical cancer. Okay. Now it is largely preventable because there is a vaccine available from 2006, and HPV vaccines are available So if a person taking HPV vaccine, then the cervical cancer can be preventable. Okay. Now, when the cervical cancer is there, now in order to diagnose that whether it is cervical cancer or any other type of cancer, at that time Pap test or Pap smear is done. Have you heard about this Pap smear? Anyone? See, Pap test, or also called as Pepinocolau test, or also called as Pap smear. Okay. Now it is done because wherever the lesion has taken place, from that particular area, with the help of brush, okay, some tissues are taken out, then the smear is produced, okay, in the slide, and then histopathological examination is done. So that particular test which is done, it is called as Pap test or Pap smear, and mainly in order to see whether the cervical cancer or not. Okay, this particular Pap smear is done. So as you can see, a small brush is used gently to remove the cells from the surface of the cervix around it, and it can be checked under microscope for cervical cancer, or cell changes may lead to cervical cancer. That is the Pap test. Now Pap smear may also find other conditions such as infection or inflammation. So when the Pap test is done, after that smear is produced, okay, and that particular slide, when it will be examined under microscope, okay, at that time whether infections are there or not, that can also be diagnosed. Okay, so that's why in case of cervical cancer, doing a Pap test is very common. Okay. Now there are 130 types of HPV, means different variants are there of the HPV. Okay, so total 130 types are there. Among them, 20 types are identified which are related to the cancer. Okay, 20 types are identified which are related to the cancer. Type 16 and type 18 are more common, which can cause the cancer. So 130 variants of HPV are there. Okay, among them 20 variants are there which can cause cancer. Among them, the most common one is the type 16 and type 18. Okay. Now here you can see this is the lithotomy position. In the lithotomy position, speculum is inserted. Okay, and through the speculum the brush is inserted, and then the cervical wall, gently it is rotated so that some tissues from the cervical wall can be withdrawn, and after that the smear is produced. Okay, in microbiology we will study how the smears are produced. So once the smear is produced, and then the lab test is done, pathological test is done, from there the confirmation can be gained, and if there is any infection, that can also be identified with the help of this particular Pap smear. That's why the Pap smear is done. Okay, next here you can see the diagram. So this is nothing but the diagram showing the lymphatic drainage of the uterus and the lymphatics which are present in the other parts of the abdominal cavity. Okay, now I have told you that with the help of the lymphatics, the spread of the cervical cancer takes place, right? So here you can see this is the uterus. Now around the uterus, these are the different lymphatics which are present. Okay, so these lymphatics are involved in the spread of the cervical cancer to the various part of the body. Okay. Now, if a patient is suffering from cervical cancer, what do you think? What will be the symptoms? Now, if a patient is suffering from cervical cancer, what do you think? What will be the symptoms? If a patient is suffering from cervical cancer, what will be the symptoms? As you can see, with abnormal bleeding will be there, yellowish vaginal discharge, lumbosacral pain, urinary symptoms, etc. Okay, these are common symptoms. Okay, in a patient suffering from cervical cancer. Now, when the spread is taking place, metastasis is taking place, at that time direct local extension and lymphatic embolization are there, and along with that it also transfers with the help of blood supply. So what is the meaning of direct local extension? Direct local extension means the spread which is taking place through different supports. For example, uterosacral ligaments are there. Okay, then lateral ligaments are also called as cardinal ligaments or McEnroe ligaments. Through that, if the spread is taking place, then it is called as direct local extension. Okay. Next, through venous blood supply also the spread can take place. Okay, through venous blood supply. That is called hematogenous. And then the lymphatic embolization. Okay, lymphatic embolization means with the help of lymph nodes when the metastasis is taking place. And that is very important. As you can see, in case of stage 4, cervical cancer can spread beyond the pelvis. Okay, or spread into the lining of the bladder, rectum, or spread into the other parts of the body. Now, in case of stage 4, it is again divided into 4A and 4B based on where the cancer has spread. In case of 4A, it will be present around the pelvis only or into the various pelvic organs. And in 4B stage, it is spreading into the organs, for example, liver, lung, bone marrow, etc. Okay, now if you see the stages, 5 stages are there, 1, 2, 3, 4, and along with that recurrent. So like this 5 stages are there, and in each and every stage sub stages are there. Okay, and in which particular stage the metastasis starts from stage 3rd, and in case of 4th it is significant. In 3rd stage from cervix it may go to the vagina, okay, or other parts of the uterus, but especially in type 4 from uterus it is going to the other organs. Okay, first it can go to the rectum. Okay, then in 4B, it with the help of the lymphatics, it is spreading into the different parts. Okay, for example, liver, lung, etc. So this is the way of spread. Now, do you remember last time I have shown you some ultrasound images, X-ray images, right? So today I will show you some MRI images. Okay, and along with that I will show you the PET-CT image. I hope you have heard about PET-CT. What is the full form of PET? Positron emission tomography. Positron emission tomography. Okay, PET scan. So what happens if there is any metastasis? If there is any metastasis in the body, at that time during the PET scan, a special type of radioisotope mixed with glucose is given to the patient. Okay, and after that, wherever the metastases are, from that particular area, high intensity signals are arising. Okay, in that way, the oncologist can delineate or can see the way of spread. Means from this particular area, the metastasis is taking in which other parts. Okay, so for that, the best way to diagnose is PET-CT. Now, different lymph nodes are involved in the metastasis of the cervical cancer. Okay. Now, it includes parametrial nodes which are mainly located in the cardinal and vasouterine ligaments. Then superficial, obturator, external iliac, common iliac, para-aortic. Okay, these are also involved. Means these are the various lymph nodes which are mainly involved during the metastasis in case of cervical cancer. Okay, hematogenous spread is also there. That means when the spread is taking place with the help of blood supply, mainly in venous drainage. Okay. Now here you can see the MRI of female pelvis. Okay, so this is the normal MRI of female pelvis. Okay, this is MRI T1 weighted image. This is also MRI pelvis T1 weighted image. Okay. Now please see the difference. Okay. Don't focus on other structures, just focus on the structures, parts of the uterus. Okay, can you see the parts of the uterus over here, everyone? So this is how the MRI images appear. After doing MRI, this is how the appearance will be there. So as you can see the various part of the uterus. Okay, now this part is the cervix. Okay, you can see the urinary bladder also. Okay, so this is the normal one. Now, in case of cervical cancer, MRI can also be done. Okay, I am not telling that only MRI, but with the help of MRI, we can easily differentiate between the different types of cancer without taking any biopsy. With the help of MRI, it can be done. Okay, a special procedure is there in the MRI. It is called MR spectroscopy, where a graph is obtained, and with the help of that graph, the different types of cancers can be identified. Okay. So here you can see the MRI pelvis, okay, showing the cervical cancer. See this particular part. So see, this is the uterus, this is the uterine cavity. Okay, so see this particular area, cervical cancer has taken place. Okay, so MRI is also a best option in order to safely diagnose the cervical cancer. In CT scan also it can be done, but in CT scan, as you know, that harmful radiation doses are used, okay, which is harmful for the gonads. But in MRI we are not using any ionizing radiation. Instead of that, we are using magnetic fields, okay, so that are not directly harmful for the patient. Next, here you can see the PET CT image. Okay, this is the PET CT image. So see, this is how the appearance are taking place. So see the spread, how the spread is taking place. So as I said, in case of PET CT, a radioisotope mixed with glucose is given, and you know that cancer cells are hungry. Okay, they need more amount of glucose, so that will be absorbed. Once it is absorbing, at that time the signals emitted from that particular area will be more. That's why that particular area will be brighter. I hope you can see this area, they are brighter. That means cancer cells are present in that particular area. Okay. Now from here, as you can see, it is spreading. Okay. So the way of spread can also be detected with the help of PET CT. In MRI, only you can see where the cancer is there, means in which particular area the cancer is present, that you can see. But in PET CT, in which direction the metastasis is taking place and which are the other organs affected by metastasis, that can also be diagnosed with the help of PET CT. Okay, that's why nowadays PET CT is very common during the metastasis to find out the spread. Next, so after cervical cancer, next applied important is the endometriosis. Have you heard about this? Anyone? Endometriosis? What happens in case of endometriosis? Where the uterine tissue, okay, it is a benign disorder characterized by presence and proliferation of the endometrial tissue outside the endometrial cavity. Okay, endometrial tissue proliferation is there, and presence of that endometrial tissue outside the uterine cavity. Okay, that is the endometriosis. It is mostly occurring at the age of 30 to 40. Now this disorder involves in the peritoneal lining, for example in the pouch of Douglas, in the ovaries, okay, distal sites in the lung, umbilicus, etc. Now this endometric tissue which are present outside the endometrium, they are in direct influence of the hormones which are secreted from the ovaries. Okay, that's why proliferation is also taking place. Now major symptoms: pain in the pelvis, then pain during sexual intercourse, pain during defecation, infertility, etc. Okay. So these are some important symptoms of endometriosis. Now here is the diagram where you can see the patches of the endometrial tissue which are present outside the endometrium, present outside the uterine cavity. Okay, endometrial tissue, and they are proliferating because they are direct under the influence of the hormones which are secreted from the ovaries. Okay, now primary diagnosis of the endometriosis is done on the basis of clinical history. Okay, now clinician first they will palpate. If there is any tenderness, then nodulating, means the formation of nodules in the uterosacral ligaments. Okay, and any pelvic mass, then tenderness or palpation of the posterior fornix are the most common findings in this particular endometriosis. Now pelvic masses are visualized by transvaginal and transabdominal ultrasound. So during the time of endometriosis, transvaginal and transabdominal ultrasound is done. Normal ultrasound, I hope you have seen. Transvaginal means the ultrasound probe is inserted through the vaginal canal, and then the ultrasound is done. That is called transvaginal ultrasound. Okay, that is also done in order to see the various part of the uterus and fallopian tube, ovaries, etc. Then MRI, CT scan is also done in order to delineate the endometriosis or the spread of the endometriosis. Okay. Now, despite of this, the most important gold standard for identifying the endometriosis is the biopsy. So, with the help of the biopsy, this endometriosis can be identified. Then next one is the leiomyoma. Now, what is leiomyoma? These are nothing but the uterine fibroids. Okay, uterine fibroids. I hope you have heard about uterine fibroids. Most common type of benign growth in the musculature of the uterus. Okay, so these are the benign tumors affecting the uterine muscles and are popularly known as uterine fibroids. Okay, now they are found approximately 25% of the women in their reproductive life. Very common uterine fibroids. Okay, now they are estrogen responsive, increase rapidly in size during pregnancy and then regresses after menopause. Now the causes are unknown, but they varies in size. Now in various position, or you can say in various parts, these particular fibroids can be present. For example, they may be intramural, submucosal or subserous. These are the various areas where the uterine fibroids are present. Now common symptoms: uterine bleeding, pain in the pelvic region, disruption of the surrounding pelvic structure, back pain, etc. Okay, so these are some important symptoms of the leiomyoma, also called as uterine fibroids. Now here you can see the diagram of the uterine fibroids. Okay, so these are the various areas. So this is the intramural, this is the submucous, and this is the subserous. These are the different areas where the uterine fibroids can present. Okay, with the help of ultrasound, okay, normal abdominal ultrasound, the uterine fibroids can be diagnosed. Okay, as you can see, this is the ultrasound scan, and see this is the appearance of the fibroids. Okay, so with the help of ultrasound scan, the fibroids can be identified easily. Okay, next is the hysterectomy. Now, what is this hysterectomy? Surgical removal of the uterus. What is hysterectomy? Surgical removal of the uterus is called as hysterectomy. Now, there are different methods by which the hysterectomy can be done. Now, before going to the hysterectomy, can anyone tell me what are the causes of hysterectomy? Why the hysterectomy is done? As you can see, uterine leiomyoma or uterine fibroids, if the size is larger, then endometriosis, pelvic organ prolapse, chronic pelvic pain, pelvic infection, etc. So these are some reasons why the hysterectomy is done. Okay. Now there are different approaches for doing the hysterectomy. Earlier, direct abdominal hysterectomy was done, but nowadays robot-assisted hysterectomy, laparoscopic hysterectomy, okay, vaginal hysterectomy are done. Okay. Now, whenever the hysterectomy is done, last time we have discussed that the uterus is surrounded by different supports anteriorly, posteriorly, and laterally. I have shown you the diagram of the supports of the uterus, right? So, while doing the hysterectomy, those supports has to be separated from the uterus, or else you will not be able to take out the uterus. Okay. Next, whenever the hysterectomy is done, the uterine artery is taken care of, and it is ligated, uterine artery. Okay, or else heavy bleeding will be there. Along with that, whenever the hysterectomy is done, okay, the cares are taken so that the ureter, which is situated on the lower aspect of the lateral border of the uterus, are not affected. Okay, so these are some points which are taken care of whenever the hysterectomy are done. Okay. Next, have you heard about this colpotomy? Now, this colpotomy is a procedure in which the incision are made in the vaginal wall, okay, to remove the uterus, drain pelvic abscess, and remove surgical specimen. This is also a important procedure, colpotomy, where the incision are made in the vaginal wall to do various procedures. For example, drain the pelvic abscess, remove surgical specimen, remove the uterus, etc. Okay. So during the hysterectomy, the colpotomy is also done. Okay. Now there is a device, okay, that is called colpotomizer. there is a device called colpotomizer, which is nothing but a uterine manipulator. So during the time of hysterectomy, when the supports of the uterus are removed from the uterus and other structures are ligated, after that, with the help of the colpotomizer, okay, the uterus is taken out, okay, from the vaginal canal. As you can see, this is the cup of the colpotomizer. Okay, so when these are the line of incision. Okay, so from this line of incision, all the supports which are there, these are detached from the uterus. Okay, then with the help of this colpotomizer, the uterus can be taken out. Okay, so this is also helpful during the time of hysterectomy. Next, in colpotomy, two approaches are there, anterior and posterior colpotomy. As you can see, so this is the uterus, this is the urinary bladder. Okay, through this particular area, if the incision is taken, especially through the supravaginal septum, then this is called anterior colpotomy. Okay, and if it is through this particular part, okay, then this is called the posterior colpotomy. And these are nothing but the fornices of the vagina. Okay, so that day we have discussed the fornices of the cervix. Okay, 4 fornices are there: anterior, posterior, and 2 lateral. Okay, so through anterior and posterior, if the incision is taken, then you can see we can reach directly into the abdominal cavity. You can see this is the pouch of Douglas. Okay, so I have told you that this pouch of Douglas, recto, uterine pouch, vesico-uterine pouch, okay, these are the potential area where, dependent zone where the collection of fluid can take place if any infection is there. Okay, so with the help of this colpotomy, the drainage of this particular area can be done. That's why also the colpotomy is used. Now, posterior colpotomy is more safer because, as you can see, in case of anterior colpotomy, it can cause damage to the bladder. Okay, it can cause damage to the bladder. That's why posterior colpotomy is generally used, and it is more safer as compared to the anterior one. Okay. Next is the HSG, or also called as hysterosalpingography. Okay, very commonly used special radiological procedure. Okay, now with the help of this particular investigation, not only the uterine cavity, but also we can see the patency of the uterine tubes or the fallopian tube. Okay, especially during the time of infertility. Okay, if a person is infertile, to know the causes of the infertility, okay, the most commonly done test, radiological investigation, is the HSG, or also called as hysterosalpingography. Okay, 2 different methods are there. Okay, among them cannula method is there and Foley's catheter method is there. Okay, as you can see, with the help of this cannula, the contrast media is injected inside the uterine cavity. Okay, approximately 10 ml of the contrast media. Now, when the contrast media is injected, these are radiopaque contrast media. When it is injected inside the uterine cavity, first the uterine cavity will filled by the contrast media. Okay, followed by there will be flow of the contrast media through the fallopian tube. As you can see, the contrast media is flowing through the fallopian tubes, both the sides. Okay, now once it is flowing, what will happen? It will come out through the fimbriated end. Okay, it will come out through the fimbriated end, and you can see the peritoneal spill will take place, spillage of the contrast media. Okay, so if the spillage is taking place on both the sides, that means it is normal. There is no blockage in the fallopian tube. Now there are some cases where the spillage is taking place in one side, or it is not taking place on either side. In that case, you can say that blockage is there. And in the fallopian tube where exactly the blockage has taken place, that can also be diagnosed, okay, with the help of the HSG or hysterosalpingography. Very commonly done. Let me show you the X-ray images. Now here you can see this is the normal HSG image. Okay, so this is the uterine cavity, and you can see how the contrast media is flowing, and you can see the peritoneal spill has also taken place. Okay, that means it is normal. Now there are some cases where blockage can take place. Now blockage can be complete or it can be partial. Okay, blockage can be complete or it can be partial. So as you can see here, a partial blockage has taken place. See the difference between this side and this side. Okay. So here partial blockage has taken place. Now in partial blockage, spasm may be there in the muscle fibers of the uterus. Because of that also the contrast media will unable to flow through the oviduct or through the fallopian tube. Okay. So here you can see the uterine cavity, which is first it will be filled by contrast media and then the contrast will flow on either side. Okay. So mainly the tubal patency okay, or the interior of the fallopian tube, whether blockages are there or not, that can be seen. Along with that, if there is any anomalies present inside the uterine cavity, that can also be seen with the help of HSG, hysterosalpingography. Okay. And lastly, the bimanual examination. Okay, that means manual examination of the uterus. In that, what happens? As you can see, one hand is placed on the lower part of the abdomen. Okay, and another hand, the index finger and middle finger is inserted through the vagina, and then gentle pressure is applied, and then the various parts is felt. Okay. Now it includes the ovaries, tubes, and other pelvic masses. Okay. This is the bimanual examination of the uterus. Okay. Mainly here the enlargement of the ovaries are there or not, that can be felt. Then pelvic masses are there or not, that can be felt. Okay. So because for that only these bimanual examinations are done. Okay. So that is all about the applied importance of the uterus. Okay. So today we have discussed many applied importance. I will request everyone to go through it, because in the upcoming exam you will be getting questions from the applied importance of the uterus. Okay. Mainly you have to study about the hysterectomy, then cervical cancer, and about the HSG. Okay. Now in HSG, as we have not discussed about the fallopian tube, that's why I have not gone much into the HSG. Okay. So HSG is mainly, as I said, to see the patency. For that, first you have to know the parts of the fallopian tube. Okay. So as I said, these 3 points are very important. Okay. So study about these points, whatever I have mentioned just now. Okay. Okay. Thank you everyone.